Neurology, pathology. All right, so here we go. There's a couple things that are just kind of random that we just need to discuss. First is phantom limb pain. When patients are amputated, have an amputation, they have just associated burning, aching, or like electrical shock-like pain, and that's going to be phantom limb pain. Okay, and it's usually secondary to reorganization of primary somatosensory cortex. Okay. But once again, lower yield. Next is diffuse axonal injury. Diffuse axonal injury is usually going to be after traumatic events of like decelerated or accelerated rapid injury of the brain. Okay, so if you're like in a car wreck or something like that, you essentially have shearing of the white matter tracts of the brain, and that causes diffuse axonal injury. Okay, and it results from white matter tract disruption, and you're going to get accumulation of transport proteins like amyloid precursors and alpha-synuclein and random proteins of the brain that start to accumulate because you essentially just sheared up a ton of neurons and a ton of the white tract matters. So all those proteins start to leak out. Okay, you're going to probably be in a coma or persistent vegetative state after diffuse axonal injury. So if you ever see someone in a severe car wreck after like acceleration or deceleration injury, and they're just in a coma or persistent vegetative state, they might ask you about the white matter tracts, or they could ask you about like accumulation of the transport proteins in the brain, like amyloid precursors and alpha-synuclein. All right. Next is aphasia. We've kind of discussed already aphasia, but aphasia is just kind of the deficit in like speaking, some type of deficit when it comes to language. Okay. So Broca's aphasia is expressive. So it's like broken. So you're not able to formulate words very well. Your speech is very broken, and the patient understands that they are not speaking very well. The patient appears frustrated. And so that's very key to understanding it being the Broca's area. Now that's going to be in the frontal lobe, right? Once again, we know that it's going to be in the inferior frontal gyrus of the frontal lobe. So keep that in mind. That's that's associated with detective language production. Okay. So they're able to understand that they're not able to speak very well. Okay. So they're frustrated. Whereas Wernicke's is that, once again, the Wernicke's area is located at the temporal lobe, and they have impaired language comprehension. So they're just talking, blabbering nonstop about random garbage, honestly, okay? And it's just a word salad, okay? But they don't even notice that anything's wrong because they can't comprehend themselves, okay? So they aren't frustrated. They actually, they're completely fine. But that's pretty much it for our, extraneous type of things. So phantom limb, diffuse axonal injury, and aphasia. Relatively lower yield video, but just thought I'd bring it up.